What I can say regarding aesthetic medicine, since it will coming in the end of the November, the last week, you will also have some lives in Instagram, in Amir Instagram, from the aesthetic week. So if you are also interested into, just follow the Instagram, and there you have a lot of information and just live from the practicals. So going back to today's topic. We will talk a little bit about the trichology, about the hair transplant, about the master, how it is going, how it is looks like, and what you can learn during the practical week. So this PowerPoint is generally dedicated to the people for next year, but I hope there are some people also which will be in this year in Madrid. So why trichology in hair and hair transplant? Since you are from different countries, as many of us know, the trichology is growing. Yeah, that's why we are here today. The opportunity to learn new skills and also gain new knowledge is the first thing. Second thing, the growing demand. The demand is really huge. And since from Poland, the most of people going to the Turkey right now, the Poland market developed completely. Really, it's crazy, it's great, and the funny fact is the prices are adequate to the patients, so the patients can stand it. So as me, as a person who is doing the surgeries, I'm doing also aesthetic treatment. Trichology is something like stopping, since we are focusing on one patient for a long time. If you can pay attention for hours, it's something for you. The other thing is all trainings or courses are international. So if you are going to the Madrid to doing this master, you will learn everything, just basically starting from what are the basic procedures, what are the European Union rules, I mean the law, because this is also important. You will learn how to proceed with patients before after care, because this is also important. Not only the transplantation is the thing. The trichology, you will see how we can check the skin, the hairy skin of the hair, but not only of the hair, since the skin is located in most of the parts of our body, our skin, which is covering us. You will also see the differentiation of the skin in the legs, in the arms, in the eyebrows. You will see and learn how to treat and how to diagnose the most common diseases of the scalp, because this is something which trichology also include. Regarding the economy profitability, since in Poland, also in Spain, but not mostly, in Spain, the trichology and hair transplant is doing mostly by the dermatologists and surgeons. In Poland, it's rather plastic surgeons, but since the times are changing, it's also possibility to doing by your own. The only need is the insurance. So the economy, you know for sure that someone who is going to your clinic to have a hair transplant, it's pay a lot of money, and you also learn how to carry of this patient before and after, how to sell the procedure, your product, your work, since sometimes it's easy because the patients know what they want, but sometimes it's your job, if you want to have economic profits. And what is also important, doing it in English language, you will know everything, since the teachers are lovely. One of our teacher is from Korea, and she will learn you a lot of like regarding the Asian market and how they are doing this in Asia. Also in Spain, also in Poland, because the teachers will be from different countries, and it's great. It's just great. So as I told, it will be great idea. Since I'm doing also my transplants in my clinic, I have contact with one of the teachers you will see in Madrid, Claudia. And in case I don't know anything, I have some problems, I'm just mailing her and I have a direct answer. So that's great. If anything will happen, you will have any questions, you have possibility to directing the questions to the specialists, yeah, which are doing it. What else is important here? During these days, you will see different, different different stuff. Every day is different. Since it's really intensive week in Madrid, you will see how different day it will be. Yeah, we will talk about it in a moment. About the general futures, yeah, 60 hours of practical training, that's the important stuff. About the flexible format of the studies, yeah, you will have a platform. In the platform, you will have a lot of PowerPoints, a lot of videos, a lot of a lot of stuff. And to be honest, since I'm 2 years after, I'm not able to manage all of the knowledge, since the trichology is not only about the hair, it's also about the skin diseases related to the hair, about the cosmetics and other stuff. You will also have here talks about the shampoos, about the peelings of the skin, about the drugs, about the treatment, about the oral treatment, topical treatment, microneedling, mesotherapy, and other. It's really huge topic. And about the theoretical classes, yeah, you will have modules. In modules, there are the different general topics, yeah. So as you can see here, I hope you can see it, and the first one is the general one. So here you will have a general anatomy, physiology, pathophysiology of the hair, the introduction of the since this is the on the May, yeah, the introduction alopecias, yeah, all the type of it. Since diagnosing it in daily, it's really important, and in Poland is that what I'm doing mostly. Just to see if the alopecia is related to the hormones, it's related to the sport, it's related to the traction, it's related to the lack of microelements and vitamins. Then you will go to the medical treatment, which is the treatment of microneedling and pharmacotherapy. Surgical treatment, we're speaking about the hair transplant, and of course the consulting room, so the talks with the patient, yeah, it's quite important. Market and marketing, yeah, so how to sell your products, since this is product not just dedicated to the everyone, yeah. It's something which is more expensive than the classical medical treatment, and the patients need to know what they want to do and how also it looks later, yeah. Since speaking about the talks with the patient, some of them some of the doctors prefer to including in the price of the transplant the whole follow-ups, yeah. Also you later giving up the PRP, and some doctors don't like it. So this is also will be huge topic here to talk, as in a module 8 communication. Other aspects will include the medical treatment and the other drugs and the practical videos. From practical videos, you will have also some videos from previous years, but also the videos recorded by the teachers for you. Let's say how to prepare some needles and procedure, etc. Yeah, so that's the topic. Here we will have. Oh, here's Claudia. She's great. You will hear her in the probably future next lives. Here you will have a just more specific look for the topics, yeah, for the topics. So yeah, we have anatomy of the hair, physiology, regulation of the growth, evidence of trichology, scalp pathologies, yeah, alopecias, eyebrows, eyelashes, yeah, that's also common. We will go mesotherapy, PRP, stem cells, of course, other supplementations, anesthesia. Yeah, that's important when you are doing the transplant. You use a lot of lidocaine, and since it can be toxic in some cases, also here will be talk about it. Also, will be talk about the emergency situations, as it is in the 4.4 point. Surgical treatment, the hair transplant consultations, and the communication. Yeah, so that's from the looking of the more details topic. And the manuals. Yeah. Also, the thing is, during the practicals, you will get some, let's say, books or prepared notes for you, also for training how to draw. Let's say before you're going to the real patient, how to draw the squares for the transplants and other stuff. How to differentiate the alopecia. I will also draw some stuff. You will also try it in the, as it mentions here. You will try to draw it in the, it's from the styropian heads. So in a plastic, it's really hard in the beginning, since our head is oval. It's not like on a paper. So you will see how it's different when you have just paper and then you have a head. It's completely different, and it's completely different also in the direction of the needle, of taking of the hair, etc. Yeah, in-person practical training. So generally, it's to just learn the practice. Yeah. Um, it will be great. The groups are really small, so about this, don't be worried. It's everyone will have time for really practicing that lot of how you want, and that's really great. And yeah, regarding to today, the intensive week in Madrid, yeah, it's really intensive, so you have to be prepared for it. And the first day, the clinical trichology and pre-transplant consultation. So this day will include the trichoscope. So this is the microscope, which is directed to the hair, not only the scalp, they're also part of the body. And the consultation, yeah. So what are the possibilities, impossibilities, disadvantages, advantages, and the possibility if we can just take this patient to the transplant or not. And in this point, what I can see from my experience, same as from aesthetic and same from surgery, mostly from commercial surgery, sometimes the patients are weird, let's say. And if you will work for a long time, it's better to skip the patients and say just thank you, but I'm not able to do it, the transplant for you, than just doing it and later have a problems, because let's say they want the money from your insurance, etc. So also we'll be talk about this and some cases, because it's really common worldwide, and yeah, it's happened. Hair techniques, real patients, pre-transplant design. Yeah? So as I told, just drawing. We will have the hair techniques with real patients. You will train also with oranges. Yeah, since the orange is it's like a ball. It's a little bit seems like our head. Yeah, it's a oval. You will train how to direct the needle, and also you will train on a fake hair how to apply it. Anesthesia and CRP, so the emergency situations and the anesthesia of the scalp, and the recipient area. Yeah, and hair transplant is the last day. Also, you will really like it. Yeah, sometimes it can be one patient, two patients. It depends. Yeah, how it is, but since in one patient we transplant a lot of hair, it is a lot of work for everyone. Also in the recipient and in donor area. Yeah, so the hands-on training will include the initial informatic meeting about the practical week, the clinical trichology, and the pre-transplant consultation. Pre-transplant design is also important, since you are not able to apply all of the hair units, let's say in a frontal row, yeah, of your of hair, because it will look weird, like in a doll, let's say Barbie, yeah. just unreal, unaesthetic. So this is also important. You will see under the microscope what are the differences in a hairs, how you can just divide the hair units. Yeah, since one hair unit can include many hairs. Sometimes it's necessary also to cut them to create the best design of the hairline. So that's really important, and in my opinion, the most hardest part to just cover the needs of the patients. Yeah, some of them they just want to cover. Yeah, I have a hair. I'm blood here. I want to have a hair, but some of them just showing a picture of Brad Pitt and they say I want the hair like that. Yeah, or Jack Sparrow. Yeah, also I had a patient like that. And sometimes if someone is just the hair is only in the bags and coming to your clinic wants something like that, of course it's unreal. Yeah, talk with the patient, talk with the patient, and talk with the patient. That's the key for everything. Yeah, if you want to sleep at night without any stress. And yeah, you will train as here we have a pictures on the right side. We have a loops. The loops are different sizes. As I told, the oranges, yeah, and the guys here are trying to put onto the orange in the right direction the fake hairs. That's what we are doing will be the FUE, follicular unit extraction, yeah, so the direct one by hands, but appliance will be manually by pincet or also by the special applicators. So you will see what is better for you and what is harder, because all the time people are divided 50-50. There is no case, yeah. And here we have the operating room. Yeah, it looks like that basically, and it's really something different from medicine. If some of you will come and never had occasion to just to try it before, it's something really different. The units looks like worms, as most people say, always. But that's great experience. That's great options to learn new skill as achievement for you. And what I can say, just if you have any questions to me, if you have any questions to the Amir, just feel free to contact. If you have any more specific questions regarding the master, regarding any specific diseases, let's say you want to ask if there will be talk about it or not, it's everything possible. That's the contact for us. I'm also open for questions. And as in the beginning, just in a last week of November, from 24 till 28, there will be lives in Instagram. Of course, there will be free, and you will have from a training room in some hours the lives of whole procedure and the treatment. So I will be also here, so it will be nice if you are joining. And regarding the master, that's all from me for today about the trichology. I hope you will like this, spending the 20 minutes with me. Enjoy your evening, and I'm waiting right now for any questions if any one of you wants to ask something. The PowerPoint also, this one will be available. If any one of you want, just text the best on the WhatsApp, and then we will send it to you.